Good afternoon, all. Hello, good afternoon. Hello, hello, good afternoon.
Good afternoon, ma'am.
Okay. Can you see my presentation?
Yes, ma'am.
Okay. So today I plan to continue the slides that we left yesterday. So before moving to the today's session, I just give some overview or the summary regarding the yesterday's session, right? So yesterday we studied under the assessment process that so how we can formally instruct the others, right? So far we discuss about this importance of assessment and the types of assessment and what are the tools we are having to measure the assessment in various situations and why this assessment is important. So all the things we studied in our previous sessions, right? So today yesterday we saw that how we can instruct the others regarding the importance of this assessment, because once you started to get informations from the patient, if your assessment is an accurate manner, sometimes the assessment process may takes about more than 1 hour, or it can be 30 minutes likewise. So the period of information gathering is little bit long. So sometimes your patients or the family members may think that why you are spending this much of time and why you are asking so much of information about the patients, because actually they are not aware about the importance of this assessment, right? So in the sense, we need to educate them. So the education is not only for a particular individual, but it should be educated to the community as well, the society. Because why? So each and every patients are coming from the society, right? So we need to educate the society as well. At the same time, even some other healthcare professionals like the physiotherapist or pharmacist. Normally, the pharmacy people and the MLT people, right? Pharmacy and the MLS people, they are not having much exposure to the patients. But physiotherapist and radio and even some radiographers as well. So the radiography people, their duty is just they will get the investigation that sheet which was prescribed by the physician, and they will go through that and they will do the necessary things which was mentioned in that investigation part, right? So they also not have much time to get the information. So normally the radiographer people, they will ask about the patient's general informations. Physiotherapist, yes, they also have some uh, part for this assessment. But when we talk about the pharmacy and the MLT people who are also included in the health sector, they are not having much exposure with the patients. And MLT people, they are not even 1% or 0.1%, they won't exposed with the people. So in that sense, those healthcare professionals as well, they were not aware about the importance of this assessment, right? So when the nurses or the doctors spending more time with each and every patient for collecting information means they may think that why we are taking all the informations, why we are spending, and sometimes some patients may not provide the adequate information. So in that sense, we need to convince them for the consent. So when convincing, some patients, they were reluctant to answer the questions that we are asking, or they may reluctant to face the physicians or the nurses. So when the other healthcare professionals observing these things, they may think why these people are spending this much effort just to gather the informations from the patients, right? But we know why we are spending more time for the assessment, right? So those things we studied earlier. So as a healthcare professionals, once we know all these things, we need to educate and we need to create awareness for the other people as well. So these are some of the pathways that we can use in order to instruct the others about this assessment process. So assessment means what? Why we are doing the assessment? What are the benefits and what are the advantages that we can gain with this assessment process? And how we are going to conduct the assessment? All those things we can instruct. So these are some of the examples that I told you yesterday, like you can conduct a supervision session. That means you can supervise your juniors as a senior person, and you can distribute the handouts and the leaflets, or you can put up a PPT, that means PowerPoint presentation, and you can conduct a staff training and the staff developing programs or the health promotion programs among the society or the workshops. So these are some of the acts we can do in order to educate other peoples, right? Then we'll see so much of positive impacts of assessment process. So all these positive impacts, it can have the effects both on the patients as well as on the healthcare professionals. But most of the positive impacts will be gained by the patients. Why? Because we are doing this assessment for the patient care, right? So if the assessment is good, then the care that we are going to provide is also going to be a good one. And when we talk about the assessment, yes, we know how we are going to take the assessment, right? So if you take the assessment in a accurate manner only, it will provide a positive or the benefits to the patient at the same time for the healthcare professionals. But if the following method, if it becomes inaccurate or improper manner, it again going to provide a negative impacts to the patient at the same time to the healthcare professionals as well. So here, these are some of the negative impacts if you are not follow the accurate method of assessment. Then care plan, yes. So care plan means it is a planning of care, right? So first of all, once you approach your patient, you need to plan a care. That means first you need to identify what the patient problem is. Then to solve that problem, you need to formulate a goals, right? So goals means those goals should be fulfill the problems that you have identified from the patients. So to attain that goals, we need to develop a plan, and those plan needs to be implemented in a proper manner. So without the plan, we can't do anything with our own. So there are some steps that we can follow when we are preparing or developing a proper care plan to get a good outcome from the patient care. So first, when we see this care plan, so we know, so whenever we are taking the assessment, so there is a two part, right? So this assessment and the care planning are always interconnected. If you think that you need to develop a care plan means before developing a care plan, you must get the assessment. That means you must get into the assessment part. Or if you need to get the assessment, then ultimately the next part will be a writing the care plan. So both these care plan and the assessment are interconnected with each other. And so when we talk about this care plan, we are telling it is not a constant or the constant process. It is a dynamic one because always it is changing, right? So yesterday also I explained you in detail that when you are going to plan a care for one patient, you can't apply those plannings to the next patient, right? Because each and every persons are differs, right? The even for example, even two people are complain about fever, in the sense the cause of fever for both of them could be vary, right? It is not the similar one. Or if the cause of the that means the reason for the fever, although it is similar, the treatment options that we are going to plan could be differ. Why? Because the planning that you are going to apply for one patient, it's differ from the other patient according to their body condition. Not all the people are having the same body responses as well. So in the sense, at least there is one difference you need to be identified when you are planning the care. That's why we are telling this care plan is also not the constant one, and also this assessment is also not the constant one. So care plan, assessment, and your goal, the goals that you are formulating and the implementation, all are going to be changed even time to time or second to second. Why? Each and every one are interconnected with each other, right? So yes, again, we saw that what are the benefits of this care plan. So why we are writing the care plan? Normally the care plan, it is a written document, right? So it's a written, a kind of legal document which would be helpful for the patient in a care part. And if we take the healthcare professionals, it will be helpful as a legal document, because if in any instances, if there is any adverse conditions happens to the patients after a particular care, then with the help of this written document, we can claim or we can debate ourselves, right? Because I am the not because what are the things I did to the patients, so I am not the responsible one for the emergence of these complications. Likewise, we can show some evidences, right? So that's why we are having a written format of this care plan. So in addition to this advantage, there are a lot of advantage we studied yesterday, right? And when you are writing a care plan, so what are the key features or the characteristics of care plan means? Normally, so we are providing or we are nominating in the health sector, or we are having a one-to-one patient care. Most of the time, we are having one-to-one patient care. So one-to-one patient care means one nursing officer responsible for the one patient. But in the normal medical and the surgical units, we can't have that one-to-one patient care, because normally in Sri Lankan setup, there are shortage of healthcare professionals. So in that sense, sometimes one nursing officer needs to look after 13 patients per day or 14 patients per day. That means normally we are delegating, right? So each and every ward, they are having 2 or 3 cubicles. So each and every cubicles may have 5 to 10 patients. In the sense, one nursing officer every day, each and every day as a routine, we are putting a roster like a delegating for each and every cubicle. In the sense, we can't provide the one-to-one patient care. Why? Because the one person, the nursing officer or one doctor or whoever the healthcare professionals need to look after more than 5 or 10 patients per day. But if it is the ICU setup, that is intensive care unit, it is a very, very specialized unit, right? So in that sense, we are following this one-to-one patient care. That means in the ICU unit, the maximum number of patients will be 6 or 7, not more than 10, right? Not more than 10. Below 10 only below 10 patients we are having, because the ICU in some hospitals it's a very large one. Although it's a large one, the maximum patients accommodation should be 10, right? So in that 10 means we are having a 10 nursing officers, and one nursing officer must look after one patient only. No need to look after the care needs of the other patient. So if there are 10 patients, in the sense 10 nursing officers will be appointed to look after each and every one patient. But that one nursing officer is responsible for all the care, right? Starting from the morning care to at the end of the care, like feeding the patient, changing the dress of the patient, and if the patients have any injections or drugs he or she needs to give, and prepare the food for the patient. So likewise, all the things, and a particular nursing officer needs to look after for his or her patients. That is, we are telling one-to-one patient care. So in that sense, that each and every nursing officer, they must need to write the care plan, right? They needs to develop a plan of care, how they are going to do, or what are their goals and how they are going to fulfill them, and what are the under the planning, what acts they implemented, what they neglected, and how the after the implementation, now how the patient is feeling. So likewise they needs to, so it is another important one of the feature of this care planning. And yes, so when we talk about this care planning, it should have an effective monitoring, and both the referrals and feedbacks will be contained under this care planning. And when you are planning a care, the team approach is important, because I already told you that one patient cannot cure with only one healthcare professional, right? So normally the multidisciplinary team approach is important to improve the health status of each and every patients who are admitted to the hospital. In the sense, when you are planning a care, you need to consult with other team members who are going to involved in the treatment options. And yes, monitoring means it's a kind of evaluations that we are checking that whether the formulated planning is going in a good way or not. And yes, so when you are writing a care plan, you need to be focused on some important elements, right? So what are the things that you need to included in your written parts, right? So those things also we studied, and here these are some of the steps. So if you are planned to develop a care means, that means if you think that you need to develop a care plan means, you need to ask these set of questions within yourself, right? No need to write each and every questions. That means you can ask these questions within yourself one by one. So then you can have some answers. So those answers will be reflected as a care plan. So those are the steps. So these are the things that we discussed yesterday. So we'll continue with the rest of the slides, right? So today what we are going to see is, so how we can evaluate whether the assessment process and the planning or the outcomes are in an effective manner or not. Or simply we can tell that whether the patient care is going in a proper manner or not, right? The effective, whether it is effective and efficient. Yes, so it is important because, so the evaluation is the important one. All whether it is a procedure or it is a program, whatever we are doing, we need to have some evaluation, right? So why then only we can identify whether we need to change our plan of care, or is it okay, or do we need to remove anything that we add unnecessarily. So this evaluation will be important, right? So evaluation is the final step of any process or program, which is crucial to determine whether after the implementation of the procedure, the individual condition improves or whether the institution achieves a particular pre-planned goals, right? So this evaluation, it can be apply to any instances, like it can apply to the patient care, at the same time to some institution as well. For example, if an institution, like apart from health and social sector, if any business companies or if any banking or any other uh, organizations, if they plan to formulate any policy or if they plan to have any program, so after the implementation of those program and the policies, so they needs to have some evaluatory part. So why they are having those evaluations? They are checking, right? Because already they have planned some goals. So with the evaluation, they are checking whether they have achieved those goals or not. So with the evaluation only, we can identify whether our goals are achieved or not, right? So how? So for example, so one patient telling that he is having a pain in the sense, so you are have first you will formulate a goal like to reduce the pain of the patient. Then you will formulate a set of plans and implement, right? So if you need to know that whether the patient pain reduce or not, what you need to do, you need to evaluate. Evaluate in the sense you can ask the patient verbally and ask them like, whether are you feeling comfort or not, or still you are feeling pain or not. So then patient will respond to your verbal question. Or you can use the pain scale, right? We studied there are a lot of uh, assessment tools are there. So for measuring the pain, there are plenty of pain scales available. According to the patient situation, you can choose one of them, and with the pain scale, you can identify whether the previous pain and now whether there are any changes. That means whether the pain worsen after the implementation or whether the pain improved or not. So likewise, so at the evaluation part only, we are identifying whether we achieved our goal or not. If the pain scale tells that the pain level reduced, so for previously once you measured with the pain scale, it was 10, but now it reduced to 5. Or sometimes the patient may tell, no, now I'm feeling little bit comfort, my pain level reduced. So that's how we can tell, okay, so the plan, the goal that you have formulated now achieved, right? By the evaluation. So that is we are telling evaluation. So evaluation could be applicable to any kind of situations, and it is the it is the final part. So assessment is the first part, evaluation is the final part, which is most important one to check whether the pre-planned goals are achieved or not. The care professional applies all that is known about a client and the client's condition as well as experience with previous clients to evaluate whether the care was effective or not. So in another thing, it can helpful for the healthcare professionals to compare their care management. So how? So whether they are providing a good care or not. So their skills and competency also can be can be checked, right? Can be compared with the evaluation. So how? So as I already told you, two patients are coming with the same problem, right? Fever. So even the pathophysiology and the management that you have planned for those two people are same, right? But the first person, that means the two people are coming, that means one person already get admitted, and after 1 week or 2 weeks only, again you are going to see or going to manage this person who had all the similarities like the first person, right? In the sense, so you can check, that means already you have planned a care to that patient, and that patient had some evaluation. So, okay, you point out some evaluations from the care that you provided for that particular first person. Then again, so as this person is also having all the similarities like the first person, okay, you try to apply all the pre-planned activities to the second person. But in that sense, the first person improved, but the second person doesn't improve with your care. Then again, you are going to check yourself. So what are the mistakes you have done? Why this person doesn't improve with the care that you are providing, right? So you can compare what are the things that you did in previously and why it is not work for the current person, how you can change it. So likewise, you are going to explore your skills and knowledge within yourself, right? So with the previous experiences you got. So this evaluation not only going to helpful for the patients, but also for each and every professionals. It will helps to learn more and more. It helps the each and every healthcare professionals to shape their knowledge and their skills and the competencies, right? So care providers conduct evaluation measures to determine if expected outcomes are met or not. Yes, so that is the important one, that normally we are doing this evaluation to check whether the expected, so what we are expected, whether we have achieved or not. The expected outcome are the standards against which a care provider judges if goals have been met and thus if care is successful. Yes. So the expected outcome are the standards against which a care provider judges. That means, so normally the expected outcome are the standard. Standard in the means those are the important one, right? So those are the important one. So that means we are comparing, right? We are judging. That means we are checking whether, because the outcomes are made or the outcomes will be provided. That means we can gain the outcomes from the goals, right? So goals means what I already told you, to reduce the pain is our goal. So outcome, it should be, the pain needs to be reduced, right? So the outcomes, they should be standardized one, which we can get from the goals. So then only we can tell, okay, the goals that we are which we were formulated also in a good manner. Providing healthcare in a timely, competent, and cost-effective manner is complex and challenging. Yes. So again, the providing the healthcare. So we are normally talking about health sector and the social care, healthcare, but even in Sri Lanka, we are having a free healthcare services. The public healthcare are free healthcare services, but each and everyone, we doesn't know about how those people are putting effort to provide those effective and the competent care to us. We are not aware those things, right? So whenever we are admitted to the hospitals, so each and every time we are, for our disease purpose, we are getting all the medicines in a timely manner, right? And they are free of cost. And you no need to get any appointment for making of for your treatment, right? So whenever you need, even it's a midnight or early morning, so whenever you develop any problems, so you can contact, or you can seek the help from them. And those people are also available 24 hours for help them, right? But those things, as a normal person in a community, as a normal community people, we doesn't know how they are putting their efforts, right? So the providing the health care in an accurate manner, it's a very, very challengeable things, right? So they are for during the COVID-19 breakdown, sorry, during the COVID-19 breakout, so there are a lot of shortage happens for the healthcare professionals, right? Because each and every second, the people who get affected with that virus is large, right? So even the healthcare professionals, they didn't imagine that this amount of people get injured or damaged by the viruses. And in some hospital, even in Sri Lankan setup, in some hospitals, the hospital was filled with the patients, and even if all the patients are coming with the same symptoms, means there were shortage of resources. So the healthcare professionals face lot of problems in order to keep each and every individual alive. So, but the people as a patients, we doesn't know how they are struggling, right? So actually working in a health and social care sector, when dealing with the patients, it is a kind of challenging and a complex one, right? And another things, you are going to deal with the living people. In that sense, even a small mistake can cause or can have a cost of the life of the people, right? So in the sense, we need to be very, very careful. Whatever decisions, even decisions that you are going to make, not only the actions, your the decisions, even the whatever you are going to take, whatever you are going to plan, can impact or had a greatest effect on the life of each and every individual. So that's why the healthcare providing, so it should be in a timely manner, and the people who are working as a healthcare professional, they should be competent enough in each and every of their sectors, and it should be very, very cost effective, and which having a complex and a challenging role, right? The evaluation process will determine the effectiveness of care, make necessary modifications, ensure favorable client outcomes. Yes. So this evaluation, again, it is important to check whether there are any modifications needs to be made with the previously implemented procedures, right? So do we need to include any more thing, or there are any updated skills are there? So those things we need to be checked. So this is a kind of introduction regarding the evaluation. So okay, so are you all clear up to now? Or do you have any doubts related to up to? Okay. So it's this is a simple definition. So the each and every phrases that they have made as a definitions for the evaluations. So those things that I told you, all the things are collectively they put in a verse to define this evaluation. The judgment of the effectiveness of care or program to meet client goals or the institution objectivities. In this phase, it could be able to compare the response with predetermined goals and outcome criteria. So the same thing, like, so the evaluation, it is a kind, so we are using this evaluations. So just to judge whether the care program that we have planned, whether we can, which will be helpful to achieve the client goals, or it can be a institutional objectives, and whether we can compare the responses. So all the things that I just told you, they have collectively put it as a definition. Now we'll see why we are having the purpose of evaluating, right? So why we need to evaluate the assessment in the health and social care. So first, determine client's behavioral response to nursing intervention. So it is not only nursing intervention, in any kind of interventions, right? So and it can be any, so the treatment option. So nursing interventions means the outcomes, right? So the implementation. So with the evaluation, we can determine so how the patient's behavioral response, how the patient responding to the planning that we are going to implement. That means the outcome, whether the patient can achieve the goals that we have planned or not, right? So it can be evaluated. So those can be identified with the evaluation. Compare the client's response with predetermined outcomes criteria, right? So the comparison. So for the comparison also, the evaluation is important. For example, if a patient is taking a care for 1 or 2 prolonged period of time, then this evaluation is important to check, right? So at the very first day, with the outcome or with the our actions, what is the evaluation, right? So after 2 days, that means after 2 days, how the patient is feeling now. So how the patient is feeling now could be identified with the evaluation. Then after 3 days or after 1 week, so when compared to the first day, now how the patient is. That means when compared to first day, whether the patient improved or not, whether we can discharge the patient or not. So those things will be identified at the end of each and every care. That means with the help of the evaluation. So for comparing the client's responses with the pre-actions or the pre-experiences also, this evaluation is important. Estimate the extent to which clients' goals are attained or achieved. Yes. So then we need to identify whether at how long we attain the client's role. That means client's goals are achieved or not. So that also will be we can see with the help of the evaluation. So without the evaluation, we can identify. So for example, normally when we are planning a goal, so what we will plan, so within 1 week of period or within two, first, that means I already told you that. So preparing a patient for a surgery is also not done in a very quick manner, right? Other than it is an emergency situation, right? So if the patient need any surgery with the emergency situation, yes, we will arrange or we can make the patient to have the surgery. But before that, if the patient is in a normal status, but patient needs to undergo for the surgery means, first we need to check the patient conditions, right? Whether how that means patient condition means for the whole, as a whole patient, right? We are checking the patient physically, psychologically, economically, and socially. So how? Physically means we are checking whether the patient body can tolerate this surgery, because sometimes some patients may have high blood pressure. So in high blood pressure means, so surgery means the patients may start to worry about their body condition, right? And even with the surgery means some people may think they will die in between the procedure. So those things may make them to become anxious. So anxious depressions ultimately leads to increase the blood pressure. If the person is already diagnosed with a blood pressure, along with all those things, his blood pressure is going to increase even more. So first, we need to make the patients to understand what is the surgery, or what is the surgery that the patient is undergoing. So what are the benefits and how we are going to do the surgery, whether we are making the patients to become sedate or not. So all the things why we are telling, we are providing some kind of education, right, to the patient. It is important. So first you need to tell how you so how the operation theater will be, and who is the person going to do the operation, and how long the patient may takes time to heal after the surgery, and what they are doing during the surgery, that means during the operations. All the things we need to tell to the patients. Why? Because only patient can get some idea. Okay, so these are the things I am going to face. Okay, so they are going to do these to my body. So without telling, it will increases the anxiety or the fear of the patients regarding the operations. And if the patients develop the increased blood pressure, sometimes the patients may develop the fear when doing the operation. So it can increases the blood pressure. If the blood pressure increases within, that means during the operation, it again going to complicate the patient's life. So first we are doing those things, right? So first we are instructing the patient. So we are having, so this is your disease condition. So for your disease, it's better to go for the surgery. So surgery means we are not plan so surgery, but as you are having high blood pressure, first you need to know what is we are going to do. So then you are going to provide a education to the patient as well as the family members. Why? Because sometimes family members also may get fear about that surgery. So before the surgery, you need to make the patients to accept the condition, right? To in a normal or in a stable manner. After that, again, you are going to check the patient physical condition. How? Whether the patient is ready for the surgery or whether the body shows any incorporativeness. All the things we need to check. Then we are going to check for the psychological side, right? So how the patient is feeling about the surgery or the operation, whether still they are depressed or whether they are accepting that one. So psychologically we need to check. Then financially means, so in the public, that means in the government hospitals in Sri Lanka, we are not claiming the money, but think about the private hospital and even in the foreign countries. So there are no any free medication. That means free medical services, right? Like in Sri Lanka. In Sri Lanka, we are having the free medical services. But when we talk about the foreign countries or the overseas countries, mostly we need to pay, right? So we need to pay for any kind of treatment, even in a government as well as the private health sectors. So in that sense, so we need to check. We need to check whether the people or the patient can afford to have that surgery within the short period of time, because sometimes they may ask to if they are financially not settled, so they may ask, right? They may ask that I need to have some times for managing my situations, that means financially. So those things we need to check. So this is the way that normally we are preparing a patient for a surgery. And in a social manner means we are checking whether he is having enough family members. That means after the surgery means sometimes the patient needs to be in a bed for 2 or 3 weeks. In the sense, all the needs to be done by the patient could be a dependent one. So after the surgery, if we discharge the patient to the discharge from the hospital, then again we need to check whether there are any family members with the patients to look after them always. Providing the meal and providing medication and all, and again bring back the patient to the hospital for the cleanings. So those things we need to check. So after analyzing all the things only, we are planning, okay, after 2 months of period we can have a surgery to you. Or if there is any problem arise in between that, then again we are postponing, unless if there is an emergency surgery in that sense, right? So that is why. So we need to estimate how much time we can achieve this client's goal that we are performing, right? Assess the collaboration of client and healthcare team members. Yes. So evaluation is another important one. We can assess the collaboration of the client and the healthcare teams, how each and every healthcare professionals are dealing with the client. So those things also identified with the help of evaluation. And identifying the errors in the plan of care when developing. Yes. So you can identify the drawbacks or the errors. How? So when you are formulating the goal, yes, you doesn't know whether the goals are correct or not. And when you are planning for those goals also, you may not have any idea whether what are the things that you are planning are correct or not. After implementation also you doesn't know, but where you can identify those errors is the only area evaluation phase. Why? So if there is any problem, that means evaluation means after all the implementation, you are going to check, right? Whether the patient condition improve. So if the patient develops any complication means, so then you can identify where you had a mistake. So where you put an error. So which part of your care become bad for the patient health status. So those things also you can identify in the evaluation. So if you identify those things, then you can change. You can change those things, and it will help for you as well to make the patient life to put in danger, right? So it is also important and monitor the quality of care. Yes. So errors and the quality of care both are little bit same. If there is no any errors means the care that we are providing, it should be a very, very quality one. And the achieve the care, that means the achievement of the goals that you have planned also, if it is a well achieved one means, yes, the care that you have provided is a quality of care. So these are some of the purpose that we are needs to have this evaluation at the end of each patient care. So are you all clear up to now? Or do you have any doubts?
No, ma'am.
Okay, thank you. So these are the components of evaluation phase. Components means how you can develop, that means how you can have an evaluation phase. That means how you can evaluate the effectiveness of your assessment process or the outcomes. What are the steps? So there are 5 steps are there. First one, identifying the criteria and standards. Second one, collecting evaluative data. Third, interpreting and summarizing the findings. Fourth one, documenting the findings. And fifth one, care plan revision. So we'll see the first one. So what is this identifying the criteria and the standard means? Nurses or all the healthcare professionals evaluate the care by knowing what to look for. A client's goals and expected outcome give the objective criteria needed a client's response to care. So identifying the criteria and standard means, so first as a healthcare professionals, you need to identify what are the goals of the client and what are the outcomes that you are expecting from the goals that you have planned and how the patient's response to those expected outcomes or the goals, right? So these are the criteria and the standards. First, you need to identify, right? So what are the goals you have formulated and according to that goals, how the outcome will be and how the patient responds. So those things you have identified. First, you identify those things. Collecting evaluative data. Evaluating a client's response to care requires the use of evaluative measures, which are simply assessment, skill, and techniques. Example, here they have put one example like auscultation of lung sounds, observations of client skill performance, discussion of the client's feeling, and inspection of the skin. Auscultation means hearing, right? So hearing, when we hear, that means, so normally when you all of you at least one time in your lifetime you may seek medical assistance, right? In the sense, so if you go to the doctor, so the doctors they used one instrument called stethoscope. So with the stethoscope they put that, that means one end should be inside their ears, and with the small round part which is present in that stethoscope they ask you to take breathing, right? They ask you to take a deep breathe, and they will place that round part on the chest side of your body or back side of the body, right? So that is means, so with that round part they can hear how your heartbeat is. Normally the stethoscope is used to check the heartbeat, right? So whether your heart is functioning normal or not. In addition to the heartbeat, yes, we can identify different breathing sounds. So normally when if the patient or if a person is having if the person is not having any disorders like us, a normal person means the breathing sound will be, it's a kind of normal, right? So when we are breathing we can't hear any the external sounds, but think about if the person is having any wheezing, right? So wheezing person means, so they take a deep breath and inside and exhale the breathing in a normal. That means they struggle more. So wheezing people, during wheezing, the people will struggle more to take the breathing. And at the same time, we can hear a large sound when they are taking a breathing, right? So no, it is not like a normal breathing. And those sounds we can identify even with the stethoscope. In addition to that, we can identify different sounds, right? So those sounds are indicating whether our lungs are functioning normally or not. So that hearing with the help of the stethoscope, we are telling it as auscultation. It can be auscultation of the heart or auscultation of the lungs. So whatever. So when evaluating the data means yes. So we have evaluating. So how with the help of the auscultation of the lung sounds, we are evaluating, right? After our procedure, now whether the sounds are normal or not when compared to the previous one. For example, so at the very first beginning, when you observe the sounds, the patient had a wheezing sound, right? So your goal is to reduce that wheezing and make the patient's breathing in a normal. So you have planned and implemented all those things. So after your plan, that means after implementing your plans, again, you checking the breathing sound with the stethoscope. And if you didn't hear any abnormal sound in the sense, okay, so you achieved your goal with the planning, because what you prepared, you need to reduce that wheezing sound. But if you still feel the wheezing sound, if it increase more and more in the sense, you didn't achieve your goal, right? So again, what you need to do, again, you need to check what are the things that you can do more, or did you do any mistakes in your care planning and even in the implementation, right? So that is collecting the evaluatory data. In fact, evaluative measures are the same as assessment measures, but healthcare professionals perform them at the time of care when they make decision about the client status and progress. Yes. So this assessment and the evaluation, the collecting evaluative data is also a kind of assessment, right? But it is not the actual assessment. So collecting evaluative data means it is also a kind of information gathering, but it is you are gathering that information to check whether the plans and the decisions that you have made are achieved or not, right? So that's why we are telling that the second phase is also the second phase, or the second part of the evaluation is also a little bit assessment part, but it's not the actual assessment that we are going to take from very first beginning. So that is the second part of the evaluation phase. Third one is interpreting and summarizing the findings, right? So using evidences that you have collected, healthcare professional makes judgments about a client conditions. So so the third part is the interpreting. So now you're going to make the decisions. That means judging, right? So what the client condition is now with the data that you have collected. To develop the clinical judgment, match the result of evaluative measures with the expected outcomes to determine if a client status is improving or not. So how you can judge the evaluation is you are going to compare. That means already you have prepared a goal. So according to that goal, you have prepared one expected outcomes. For example, you prepared a goal, right, to reduce the pain. So to reduce the pain means your expected outcome also, the patient needs to feel comfort without pain. Then, so with the collection of data, now you can identify what the patient is telling. So patient may say, I'm still feeling the pain. So still feeling the pain means you didn't reach your expected outcome, because the expected outcome must be patient seems to be happy, but according to your client response, that means after the procedure, using the evidence, you find out that the patient is very unhappy, right? So that's how you can compare with the help of the expected outcomes. So that is third one. So what you are doing with the help of this evaluating data, you are interpreting the findings, you are checking whether the goals and the expected outcomes are achieved or not, and you are going to summarize. Summarizing means you are just telling. So how the patient is feeling now, or if the expected outcomes are not achieved, then what are the errors you did, or whether you need to develop any new plans. Those things we will summarize under the third part. And once you summarize, you need to document it. That means a written document under the evaluation phase. So you need to document it in a proper manner. Documentation and reporting are an important part of evaluation. Written process, that means nursing process notes or assessment flow sheet and information shared between nurses during changes of shift reports communicate a client's progress towards meeting expected outcomes and goals for the nursing plan of care. So here they have mentioned the nursing plan. So it can be applied to all. So documenting the finding means it's a kind of report writing, right? So you need to document, you need to write under the evaluation part, you need to write. So what you plan and what are the expected outcomes and how the patient is feeling now. And in addition to this written documentation, we can have a verbal document as well. So how we can have a verbal document? Normally in the hospital setup, uh, the nurses and even the doctors, we are following one method as a handing over takeover method. So what is this handover takeover method means? Normally each and every healthcare professionals, they are working as a shift, right? So 1 to 3 or 1 to 4 like a shift. So think about, I'm just telling an example with the nurses. So one nursing officer, she works for the shift 1 to 7 to 1, morning 7 to afternoon 1. Then so after 1 she's going to be off. So again another new nurse, she is coming for the 1 to night 7 shift. So the first nurse, before she get off to her shift, what she need to do, the new nurse, that means the new nurse who is going to start the shift from 1, both the person will go to each and every patient side, and the previous work nurse, she is going to document each and everything to the new shift nurse, like so what the patient condition is and what are the complications the patients develop during her shift, and what are the goals that she planned and what she implemented, and what how the patient is now, that means how she evaluates. So all the things in addition to as a nurse, she written all the things in a written format, but in addition to the, she is telling all the things that she have written in a verbal form to the next nurse, next shift nurse, right? So for likewise, each and every patient, whoever the patients she look after, she needs to tell to the other nursing officers. After that only, the new nurse, shift nurse, she can take the, so that means she starts to work, right? So that is we are telling it as handing over and takeover. Why? Because if there is no any handing over takeover means the new person who is going to work doesn't know what each and every patient condition is and what the previous nurses did procedures did to them and what they needs to do. So if so all those things making the patient care needs to be an effective one. So for that only we are having this handing over and taking over. So the verbal handing over and taking over also a kind of documentation of the findings during the evaluation phase. So that is the fourth one. And the fifth one is care plan revision, right? Evaluate the expected outcomes and determine if the goals of care have been met. Then decide the need to adjust the plan of care. If goal met successfully, discontinue that portion of the care plan. Yes, I already told you that reviewing, right? Revision. So the evaluation, we need to revise it. We need to review it. Whether under the evaluations, whether the plan, the whatever we plan, whether it's happened in a good manner or not. Whether it happened in a accurate manner or not. So if it is not, then what we need to do next, or if all the plan that we have did achieved in a good manner, in the sense there are no needs to put or develop a new plan of care. So that is, we need to have a review. Okay, review, revisions are same. So these are the 5 major steps that we needs to be that we needs to be follow when we are having an evaluation of the assessment process and the outcomes, right? So yes, so that is the end of today's lecture. That means the evaluation. So how we can have an effective evaluation, and how we can develop a care plan. So do you have any questions so far?
No, ma'am.
Okay. Today I plan to provide your assignment for this particular module. So I want to provide some instruction because you have some differences when compared to the previous assignment, because previously you did the 2 assignment in a way of report writing and the essay writing, right? But for this module, I think for my module only, for the second module, it's also a kind of report writing, and in addition to the report writing, you are going to write a staff briefing, right? So I explain you what is the staff briefing and how you are going to write the staff brief, right? So your 2 tasks, task 1, it is a report writing. The task 2 is a staff briefing. And the second one, I need to tell you that for the previous module, I uploaded the assignment in a 2 different time slot, right? The first assignment, then after 1 week, I think I uploaded the second assignment, and also you submitted the assignment in a 2 different parts. But for this module, no need to submit as a 2 different parts, because I uploaded 2 assignment. That means 2 tasks at 1 part, and you also can continue to write your 2 assignments in 1 part, right? So that means no need to write as a separate 2 parts. So first, normally at first you will have some introduction, that paper which includes all your registration number. Then the second one, it gives the module description. Then third and fourth one, you are having the brief about your task 1 and 2, and the guidelines, how you are going to write. And next to the guidelines, we have uploaded the declaration form. That means the student declaration form. So continue to that student declaration form. You are going to start to write your assignments. In that sense, you just put a heading as task 1 and starts to write the task 1 assignment. And once you finish the task 1, then in a new page, start a new page and put task 2 and continue to write the task 2, right? So all the things will be included as a 1 document. So there are no any separate 2 documents for this module, right? So it will be easy for you as well to write. So you need to submit only, each and everyone needs to submit only 1 document, right? So I just prepare one simple that means a PowerPoint presentation to explain you regarding the staff briefing. So can you all see my screen?
Yes, ma'am.
Okay. So I think you already know some these things, right? Because you already finished, I think 6 assignments for the for 3 modules. You finished 2, so each for 2. So already you finished 6 assignments, and you are now aware about when we are writing an academic parts, how we need to write and what are the major components like this, summarizing, paraphrasing, and quoting, all those things you need, right? But for your like just a summary, I just included this as well. And in the previous session also, you submitted a report, right? A report writing. So now you all have an idea. So what is this report and how it is differs from the essay, how you can write a report, all those things. And there are some different types of reports. So I also included how you can write a very good report. And here for this module, in your first assignment, you need to write an information and guidance report, right? So information and guidance report means, so I just so in your task 1, give me 1 minute. Okay, so in your assignment, so the task 1, you are requested to write a guidance and information and guidance report, right? So what are the things that you need to include are, it should be, so we studied regarding these assessment models and assessment tools, right? So first you need to explain why we are studying these assessment models and tools, and the purpose of assessment tools, and that partnership working, right? So how you can analyze the partnership working and how it is supporting the assessment process, and how you can use the person-centered way when you are supporting an individual to actively participate in the assessment process, and how you can make an assessment, and how you can what is this referrals, and when you can referral process for an individual. So if an individual, in the sense, at what time or at what instances you can take. So these are the things will be included in your task 1, right? So that is information and the guidance report. So information and the guidance report means no need to think more. So you can write as a normal report writing. So here I have put one link. So it is which states the careers education information advice and guidance. That means it is one of the information and guidance reports which mainly focusing on the careers education, right? So in the sense why I put this, you can just click it and see how they develop this report, right? So you can have this as a model when you are developing your information and guidance report for the task 1, right? So it is also similar, and you need to be very much cautious about your word count. It should be 1500, right? So this is about your first task. The second task is staff briefing. So what is this staff briefing means? You are going to, the staff briefing brings the employer and the employees together with their teams on a face-to-face basis so that information can be delivered, question asked, and feedback collected. So staff briefing means you need to prepare a document, right? If the document, it should not be a detailed document. All the contents that you are going to include should be in a brief manner, but report is not like that, right? So report in the sense you can include your results or conclusions or whatever in a detailed manner. But here with the term briefing means it is not in a detailed manner, right? It should be in a short and simple. So staff briefing means normally when we are using this staff briefing, when we are working in a team, each and everyone, we will write what are the things that we did and what are the plans we have planned. And so likewise, all the things we are having. When just think about a meeting, right? So you all are working. So just think about you are going to have a meeting with your head or the supervisor. In the sense, each and every one, so each and every day we will have a monthly meeting or yearly meeting. In the sense, we will prepare one report. It's not actually report, just a kind of paper, right? So we will include what are the things we did for 1 month. So what are the improvements we have when compared to the previous meeting, what we are planning to do in the after that, after the month. So what are the future plans? So all those things we will write it in a short manner. Why we are using to deliver? So we are discussing, right? So in a team. So those information, so you can deliver, and in those meetings, you can have a questions, QA sessions, and you can give a feedback and you can collect a feedback. So that is, we are telling staff briefing. Staff briefing means what are the things that you are going to tell to your teams. You are going to prepare it as a report or a paper. So that paper writing or the report writing, we are telling it as a staff briefing. So for your task 2 also, you need to write a staff briefing, including some things, right? So again, a briefing is designed to provide quick and effective about an issue. It is often used to influence the decisions or the solutions. Briefing can be delivered as a short written document or presented in person, right? So here it is important. Briefing, it should be delivered as a short written format, or you can deliver it in a person. That means you can tell verbally, right? Here. A briefing is a discussion between 2 or more people, often a team, using succinct information pertinent to an event, right? So what are the things that you have, that means you did, or what are the things that you are going to do, particular event or a monthly meeting or yearly meeting, you are going to write. A brief immediately map out the care plan. Yes, so it should. So briefing, your staff briefing should identify what your plan of care. Okay, so that's why it should be very, very short and sweet. So what you have planned, what you have planned to achieve the goals. So those things should be easily identified. Your plan of care should be easily identified with your briefing. And identify the each team members' roles and responsibilities. Yes, if you are going to work as a team, when you are preparing your plan of care, so you will assign each and every team members who are those people. So those people's roles and responsibilities also should be mentioned very clearly. Heightens the awareness of the situation. Yes, so you need to aware the situation, highlight the situation, the problems, right? So if you identified any issue, so the importance of the problem or the issue should be highlighted. Permit the team to plan for the unexpected, allows the team members' needs and expectations to be met, sets the tone of the day, encourage the team members' participation. So other than this, these 3 are the important one. Map out the plan of care, identify the each team members' roles and responsibilities, and highlight in the current situation. So these things should be your briefing, your staff briefing should be tells clearly mainly these 3 things, right? So when you are writing the staff briefing, so how you can make your staff briefing, how you can structure your informations when you are writing a staff briefing. So there are 3 main parts, right? Purpose, main body, conclusion, and recommendation. Purpose means it can be a statement of your problem or the issue, which you can write in 2 or 3 lines, but you need to be clearly explain the purpose of the briefing, right? So why you took this issue. So that means if you are going to write anything means why you took this issue, what is the purpose of writing this briefing. No need to write as a 1 page like. So the purpose, it can be a 2 or 3 lines or 1 paragraph is enough for writing, because all the things should be in a short and clear manner. although you are going to write in a one paragraph, the needed thing should be included in a short and clear manner. So then we'll going for the main body. In the main body, in the sense, so information about the background that you already know, right? So in the report writing, you wrote a background, an introduction. So like that, right? So the background, what is the current situation, why you are writing, what you are planning, all the things you can include. And like in the report, even in the staff briefing also, you can include the graphs, figures, pictures, and tables. That means if you think those inserting those things are needed, yes, you can include it. But the ultimate thing is it should be easy and clear. What you have included in a picture, it should be easy to understand and it should be clear. And conclusion and recommendation, yes, it is a summary. So under the conclusion and recommendation, normally when we are writing a report, recommendation means we will give some solutions, right? When we are writing a report, we will give some solutions for the future. But when you are writing the staff briefing under the conclusion, no need to tell any new things, right? So your summary should be the previous parts. That means during in the introduction, main body, and the purpose. So what you have mentioned some things. So all the things should be collectively summarized and stated in a simple manner in the conclusion. No any new things needs to be added other than the, that means if you are not add any new things in the introduction, means you are not allowed to add those things in the summary as well. So this is how you can develop your structure informations when you are writing a staff briefing. And staff briefing means what are the components, means it should be short. Short means more than 5 pages. Normally for the staff briefing also you are allocated, that means you are requested to write about 1500 words, right? So 1500 words means actually it is not more than 5 pages, right? So you can write more than, that's 1500, no needs to exceed more than 5 pages. Within 5 pages you can write, because it is a briefing, right? It is not the exaggerated one. And clear, yes, whatever you are writing, you need to be clear and don't use any abbreviations or any jargons, that means medical or the terminology words. It should be very, very simple, which can be understood by all the people. Conscience means it should be well edited, not too wordy, means no need to use too much of words. That means if we are writing a report, means we sometimes use some words in between. That means we sometimes we use some adjectives or the adverbs, right, to tell more about the information. But in the staff briefing, no need to add those kind of adjectives or adverbs. You can shorten the words. That means your word, the needed words, it's enough. No need to add too much of words or the explanation. Reliable means yes. So the informations that you are including, it should be accurate one, and there are no any missed information. And proofread. Proofread means yes, you can go through if there are any errors, right? It should be professional ones. So these are the components that you need to be include and you need to be used when you are developing your staff briefing, right? So for for your comfort, here I have put one checklist. Checklist means no need to add these things into your staff briefing. So why I have put this here, you can identify there are some set of questions are there. So before writing and when writing. So you can have this document or the checklist as a draft and you can tick it, right? When you are developing, you can tick whether you have completed all the things that mentioned in here. So when before writing, what you need to know is remember the 5 W's. That means who to whom you are writing, what you are writing, so where you are writing, when you are writing, why you are writing the staff briefing, and how you are going to write. So when you are asking each and every questions within you, then you will have some questions, right? So according to that questions, that means you will develop one questions. So each and every questions you can have some answer. So according to that answer, you can identify what is the purpose of writing this staff briefings and whether you have included all the necessary informations or not. So here's the second question. Do I understand the purpose of this document, right? So you ask within yourself, do I understand the purpose of this document? Then you can have an answer, yes. So I understand the purpose of this document. Then what is the purpose of writing this staff briefing, right? So now you have covered the purpose of writing your staff briefing. Who are my audience? So to whom I am writing, then again you have the answers. So to whom means, so okay. So my team employers, that means to the head I am writing in the sense. So what are the things I need to include when I'm going to explain to my head? Again, you will have the answers, right? So likewise, before writing and when you are writing, during and before writing, you just ask these questions within yourself, right? You just make a draft and ask your questions. And once you find out the answer, just tick it. So with the tick, you can identify whether I have answered for all those questions. That means if you answered all these questions means you have now developed a structured way of writing your staff briefing. That means you get some idea, a framework for developing your staff briefing. Then it will be easy for you to include all the informations in order, right? So no need to, that means it is just for your easiness. I put this one. So you can use it as a draft. No need to include this checklist in your assignment, right? It is only for your rough use, right? Here there are some tips how you can write. So tips means you need to provide key points to the reader and the title should be limited to 10 words, right? So when you are providing the title, each and every title, no need to use a very big title. And yes, it should not have, and normally for the reports, we are writing an abstract, right? Most of the times we are writing abstract, but here no need to have those abstract and everything. And no side headings with the exception of a single heading for methods. No need to write. If you need, you can include the subheadings, but most of the times, if it is unnecessary, no need to include that one. And here it must have a restricted word count, less than or 3,000. But as for you, we are instructing you to write the staff briefing within 1,500 word limit, right? And yes, you can use the figures and the tables, and you must need to include the references, right? References is important for using this. And here you can identify these are some of the things that you can keep in mind when you are developing your staff briefing, right? So that is about writing the staff briefing. And for your staff briefing, so I already uploaded the assignment to the teams as well. You can go through. So for your staff briefing, you need to prepare a staff briefing, which includes how you can develop a care plan and how you can evaluate the effectiveness of assessment process. So those two things I already finished. And there are two rest of the things that how we can develop an action plan to address if there are any changes in the assessment review and how we can summarize the summary of an assessment process, that whether the staff can identify the impact of the assessment or not. So those two, the rest of the two will be covered in the next week class, right? So under that, and also we have provided one link to each and every both of the assignment. So you can go through that link as well, which will be a more helpful reference material, right? So they have explained more detail how to write a staff briefing, and even you can get an examples, right? So there are some examples are there. So you can have those examples to develop your staff briefing as well, right? So I uploaded the assignment today. That's 30th of October. So as per the guidelines, you need to submit after 1 month. So your due date will be 30th of November 2022. Right? So again, I'm telling no need to follow separate two documents. Just submit both the two assignment as a one document. Right? So are you all clear up to now? Or do you have any doubts so far? Okay, so you just go through the assignments, and if you develop any doubts when writing, because report writing, okay, you can write, but the staff briefing, when you are writing, if you develop any doubt, don't hesitate. You can contact me anytime. I'll explain it further. So there are a lot of examples are there when once you get to that link. So you just go through, and if you have any problem afterwards also, you can ask, right? So are you all clear, or do you have any issues?
No, ma'am, not at the moment.
Okay. So what about the others? Are you all clear?
Yes, ma'am.
Yes.
If I
Okay.
have any problem, I can contact you, ma'am, about assignment.
Yes. Yes, yes, sure. You can contact me. I can explain to you, because staff briefing is the part that you may have, you may develop some problem, because other one is a normal report writing. Because already you did one report writing, no? It's the same thing, but just go through that PDF, right? The PDF I uploaded, just go through that, and the PPT of this assignment brief also I uploaded to the MS Team along with the lecture 8 and 9 page, right? So you can go through that as well. And if you develop in doubt, you can ask at any time. Okay, so as you so far you are not having any doubts, we will wind up the session today. So I'll meet you all in the next week. Okay, bye bye. Have a nice Sunday.
Thank
Thank
you,
you,
ma'am.
ma'am.
Okay.
Thank you, Miss.